to some other medical news now and some answers to questions you might have that a lot of people seem to have about eye drops tonight. After all those warnings from the FDA. The FDA, remember, is just putting out its third warning this year saying 27 different kinds of eye drops are not safe. 122 million of us put drops in our eyes. This is like a third of the population. 1 in 3 people, if you're sitting with 2 other people right now, one of you probably uses eye drops. Erika Edwards is joining us now with more on this. And so people, I think, are feeling really anxious about it. Like, wait a second, okay, these ones have been pulled off the shelves. The FDA is saying this warning about X. People get nervous about blindness. Let me just say this. Nobody needs to freak out yet, right? Explain what we should know.
Hallie, I will be the first to tell you when we need to freak out. But right now, this is not that time. At least that's what experts are telling me. This is just a time to be cautious about what we're putting into our eyes and how we are doing so. This affects many of us. Just as you said, just today I pulled out, 4 different kinds of eye drops from my desk drawer. Autumn is the peak season for eye drop use. The air is getting colder and drier. I don't know about you, but my allergies are off the charts right now. So all of us are dealing with this. In fact, estimates show, as you said earlier, 123 million of us are using eye drops and will so within the next year. Here is what we need to know, though. The FDA is warning against 27 different kinds of generic eye drops because of bacteria found in the manufacturing plant used to make those eye drops. Now, you can find all of those different brands on the FDA website, including ours, NBCnews.com. Right now, though, there are no reports of injuries related to those eye drops. However, experts say that you need to really be wary of, how you're putting them into your eyes. Go ahead, Kelly.
No, they say be careful how you put them in your eyes, wash your hands, don't share drops, use brand names, right? That's another one, because our eyes are particularly vulnerable to germs and bacteria. They're just these little, exposed orbs, our flesh, exposed to the...
That's right. If you have a cut and you get bacteria in your cut, your white blood cells rush to that cut and they create a scab, right? If you ingest something that has bacteria in it, our stomach acids start invading those bacteria. However, our eyes are completely different. The corneal dome, as the experts say, don't have blood vessels there because we need to be able to see clearly. So there's not that protection in the eyes when it comes to other parts of the body. That's why it makes it so important that the fact that we make sure anything that we put into our eyes is as sterile as humanly possible. Hallie.
Erika Edwards, fascinating and really helpful information. Thank you so much.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.